Welcome to today's episode, brought to you by the Women in Medicine Summit, a transformational CME conference happening September 13th to 14th at the Drake Hotel in Chicago. Engage in leadership programming, learn negotiation skills, receive on-site coaching and mentoring, and see who will win this year's I Stand With Her awards. This year, we're excited to offer unique programming that includes a special session on how using improv comedy can bring fun back into medicine. We also have financial sessions tailored to help you navigate the complexities of personal and professional finances. Discover ways to advance into leadership roles, combat burnout, and either reignite your love for your current role or find joy in a new career path. Don't forget our Friday evening gala, a highlight this year you definitely won't want to miss. Register now at womeninmedicinesummit.org and be part of the movement that is shaping the future of healthcare. Join us to network, learn, and celebrate the power of women in medicine.
Hi, a core value here at Revitalize is respect. I'm really excited to bring you a conversation with my friend and colleague, Dr. Avila, as we discuss her transition. In this episode, we discuss her experiences, how to be a good colleague and ally, and we discuss some of the terminology around sex, gender, and transitioning. We'll bring this conversation to you in two parts. While there's been a lot of controversy around trans rights in the media, what is not controversial is being kind. Both Dr. Linda Lawrence and myself felt this was an important conversation to bring to you because regardless of your political beliefs, kindness is key. And respect and kindness are two values that we have here at Revitalize, and it absolutely breaks my heart that anyone would be cruel or worse to a transgender person, because at the end of the day, people are people. I want to thank Dr. Avila for being courageous, sharing her story with all of us today. She's a wonderful educator, doctor, wife, mother, and person, and I feel very privileged to be her friend and be her colleague. Without further ado, we'll jump into today's episode. Welcome to the Revitalizing Doctor podcast. We interview trailblazers in medicine that embody the Revitalize Women vision to empower women to innovate and influence medicine, to value authenticity, respect, and work-life harmony. We recognize the challenges in medicine, and we're committed to providing coaching-informed strategies to help you go from surviving to thriving. This is a very special episode today. I am thankful to be sitting next to my dear friend and colleague, Jailyn Avila. She is my friend and colleague. She has recently transitioned to being a woman, and we are recording this episode to share her journey and also to help all of us be better allies. This conversation will focus on expanding our understanding of trans people. This is not medical advice. What we hope to do is inspire people to be curious and kind. Thank you so much for being here with me today.
Of course. I'm so honored and so happy, and great job with the last name, by the way. No, really, you did great. And this is there's all these kind of layers that I've been trying to work on. And one of them was when I went to residency in Tennessee, there's not a whole lot of Hispanic words or names there. And so I tried to teach people that the correct pronunciation was Avila. And it was very hard. And so after about a year of trying, I went with the most common mispronunciation, which was Avila. And that's why in a lot of my videos, I'll say Avila, especially early on, because I don't know, I just kind of went with the flow and didn't really know how to assert myself, I guess, in the exact way that I'm happy doing now. But the correct pronunciation is Avila. I think technically there's supposed to be an accent on the A, I think. But all that being said, the pronunciation of my last name is not something that I guess bothers me at all. So it's fine. So nobody ever needs to stress out about my last name. But if anybody wants to know, it's how Andrea said it, Avila.
And I love this because I grew up in Iowa and my name is Andrea. And I always joke that the pronunciation is get into your hypernasal Midwestern voice. But now that I live in San Diego, people say Andrea. And I respond to that, and I like it too. I mean, if somebody asks, I'll tell them, I grew up and it was said this way. but I really like that I live in a place that's multicultural and that there's different ways to say our name. But the most important thing is when someone asks, try to get it right, try to be kind. And that's why we're doing this episode today.
Yep.
So let's dive in with, tell our audience a little bit more about yourself.
I mean, how far back do you want to go? Like where I was born? Like what are adult life? Like,
yeah. Let's go as far back as you want to go. Just who is Jailyn Avila?
So I was born back in 1984 in Loma Linda, California, to very religious Hispanic parents. My dad subsequently joined the military, and so I grew up with that as well. I lived around, went to Naples. There's a big Navy base there. Actually, might be, it's a Navy base. There's Marines there. And then we lived in Chesapeake. I lived a year in Argentina. As my first year of college was in Argentina. It was really fun. Went to school in Riverside, California, med school in Loma Linda, residency in Tennessee, fellowship in Kentucky. I stayed in Kentucky where I was the ultrasound director for all inpatient, outpatient University of Kentucky. It was a big job. It was a lot of work, actually. But it was fun. I learned a lot. And probably, I want to say maybe 2.5 years ago. So I've been here, no, I'll say 3 years ago. Been here for about 2 years. My wife and I were seriously discussing what we wanted to do for retirement. And we were saying we both knew we were going to retire back in California. And then we kind of paused and we're like, why are we going to wait until we're in our 60s and 70s to move where we want to move? And then we worked on the process and now we're here in California.
So some of our listeners, you have a pretty big social media presence with your company, Core Ultrasound. And so many people may know you as Jacob.
Yeah. So some may call that my dead name or their dead name. Now that's something that is everybody's kind of, journey in life is their own journey, and they have their own things that are triggers, their own things they're comfortable talking about or with. So I was born, actually, I don't know if I've told you this. The name on my birth certificate is Julio, actually.
Oh, I had no idea.
Yeah. So it's kind of a long story how I ended up with Jacob as a name. But anyways, my birth certificate name is Julio. In the last year of med school, I changed my name to Jacob and started in probably my second year of residency, beginning of my second year, doing ultrasound videos. I published them online, and that's grown to a bit of we sell to residencies now, internal medicine, EM, everybody. We have definitely a lot of free stuff on our website, coreultrasound.com, and on the YouTube page. And on all of those, it is Jacob, because that is my former name, which is how I choose to refer to it. And the reason why is because I feel like that's a part of me. It was a very, it's literally the biggest chunk of my life was that. And so for me personally, for me to call it a dead name is not my truth. What my truth is that was my name, and now my name is Jailyn.
I love that. I had never heard that term before, dead name.
Mm-hmm.
So it's helpful to know that might be language that people use around it, and they might feel that strongly about using that name before. I think what's complicated though for us being physicians is our names. Honestly, I was married before my now wonderful husband, and I changed names when I was married previously, took my then husband's last name. And then we got divorced in medical school. And then I went back to my maiden name. And then I decided from there on, I would never change my name again, because to this day, I sometimes still get pieces of mail with my prior husband's name on it when I had his name. And I'm just floored by that. I've never used that name professionally, and that it still follows me. And when the divorce was fresh, I would get really, triggered by it. At this point, I just kind of laugh. I'm just kind of amused that this many years later, I don't have the reactivity associated with it anymore. But a lot of people have to change their names for a myriad of reasons. What's your advice for navigating that process? Stay tuned. We'll be right back. Are you a physician mom with school-aged children feeling utterly exhausted? My friend Dr. Sheeta Shaffi invites you to take a little time this summer to join her in a small, intimate group for meaningful conversations. Dr. Shaffi is an emergency physician, coach, and mom to 8-year-old twins. She understands firsthand what you're going through. This isn't a pizza party or a yoga class. You'll meet for 2 one-hour sessions twice a month starting in July to help you move out of exhaustion, let go of mom guilt, and live a life you're not only proud of, but can truly enjoy. Connect with her on LinkedIn or Instagram at Sheeta Shafee to learn more. Sheeta is spelled Shideh, and Shafee is spelled Shafie. You can also check the show notes for a link so you can connect with her there as well.
Yeah, it's a tricky one. There's a lot of people, people that I know that their legal name, they have no interest in changing it, is a certain name, but they're like, hey, like, I don't know, like their name on their birth certificate is Mark. They want to be called Michael, and you just call them Michael. And it's like that easy to just say like, hey, this is my name, and introduce yourself as that. But to legally change your name, it's different in every state. And I actually just on Friday. So this is Monday, and on Friday, I got my court order for my legal name change, which is Jailyn Elizabeth Avila. And it took 3 months. So it took a bit. There's like a fee and stuff, but it's doable. With regards to like how I chose Jailyn, there's a lot of ways that it can be done. My wife and I actually sat down and we wrote actually a list of names that started with J. The letter J is like my letter. Every name I've ever had has started with J. So I needed a J one, and I wanted something that was mine, and that we just went down the list. It probably took a few weeks actually. And then we settled on that. And I'm happy with my last name. I mean, even though there's members of my, my family that I'm not super proud of, it's mine, and I'm okay with that. And so I wasn't interested in changing my last name. I didn't have a different one to like fall back on. My wife's maiden name is Opitz, and it's a great last name, but she personally didn't like that last name. She likes Avila more. And I wanted to do something to like connect with my wife. And so we have the same middle name. Like Elizabeth is Shanna's middle name. So I took her middle name, and then she kept my last name.
I love that. I love people's name story. And then, I think what also is fascinating is I was just in London and had a lot of alone time in May. And I seriously thought about taking Chris's last name. And so we, exchanged some messages while I was gone that like, I'm thinking about maybe if I like the alliteration, Andrea Austin, but I'm like, Rhea Renders, like to shorten it to that. And I like the Rhea pronunciation better than Rhea. I haven't made any movement on that. I've got a few other things on my plate. Now, I probably will stick with Andrea Austin. But I think what's fascinating about it, and I keep learning this throughout my life, there's phases where you're like, definitely not going to do this, or I would never consider. And I think it was also like, I didn't want to change my last name. I felt like that was rooted in maybe patriarchy. And now, after being married for more than 10 years, I'm finally feeling like if I changed my last name, it really would be my own decision, not influenced by him, his family, by society. It would be my choice. But it took me 10 years.
No, that's fine. And honestly, like if you never changed your last name, like that'd be okay. That doesn't mean you're not married.
Right.
Or you're still married.
Yeah,
you don't have to have that last name. So
yeah. Interesting. All right. So let's delve a little bit more into what the focus of today's episode is on being better allies for trans people. And I am still learning the correct vocabulary. And I also feel like it would just be helpful for our audience to kind of level set on some terminology. Mm-hmm. So let's start with sex versus gender, which may seem kind of basic, but I think we got to go there.
Yeah, no, I'm very happy to. And I'll try not to say this too much, but one of the things is that this is kind of my interpretation of my journey. And really, like, I don't want anybody to think that I speak for every trans person. That is absolutely not the case. Just like a cis person doesn't speak for every cis person. That's the same thing.
Thank goodness. I don't claim out all of that. Yep. We're all speaking for our own experience.
Right.
Yep.
So sex. So biological sex is basically, do you have a Y chromosome or not? That's biological sex.
Right.
Gender is basically what your outward expression is and how you want or what you want your position to be in society. I have a Y chromosome. Nothing I can do about that. But my gender is female. because I want to exist in the society in which I live as a female. That's where I always feel more comfortable. And so that's gender, it's female, and then my biological sex is male. And that's something that I think some trans people struggle with, but it's who I am. And I think for me personally, I accept, I would, if there was it was like a interesting argument early on that actually helped me. It was if you could flip a switch and you would immediately be transformed into the opposite opposite sex. That's everything. Genetically, I'd get rid of all my Y chromosomes. Before that person finished the sentence, I would have pressed the button or flipped a switch. But I can't do anything about that realistically. But what I can do is I can wear the clothing that I feel the best in. And I can take medicine that I guess is starting to get my body to me actually feeling comfortable in it.
Mm-hmm. Yeah, that you have this feeling inside of you, and the medicine is helping you get to where you feel more aligned.
It's getting my outsides to look a little bit more like my insides.
Yeah. Awesome. So now, could you define what trans means?
Of course. So trans, if you just think about transcontinental, right? It just is other side. It's like a cross.
Mm-hmm.
So transgender is somebody who was born a male, but chooses to live as a female. That would be a transgender female. So you're going to the other side of the gender.
Yeah.
And then a transgender male or trans male is somebody who was born without a Y chromosome, but who chooses to live in society as a male.
So I think what sometimes I get a little bit confused about is then how does that relate to non-binary? So are there people that don't feel strongly in one camp or the other?
Yeah. And that's something that, again, everybody's thing is different. There's some people that exist in the middle. They feel like they're neither masculine or feminine. And there's people that some days they feel more masculine and they want to present masculine. There's other people where they want to, other days, that same person will want to present more feminine. So they kind of go imagine this is the line. Mm-hmm. They kind of do this number. Okay. And that is actually an important thing to keep in mind as well, is that gender in reality, it's a bit of a spectrum, right?
Right.
You got to think about it. And this may be not the best example, but you have, right? If I say girly girl versus tomboy, generally you think about somebody who is, very feminine, pink everything, dresses, things that very heavily into the camp of everything as feminine as they can. And then on the other side, you have a tomboy who still is a woman and identifies as a woman, but maybe they have short hair, right? They have a buzz cut. Maybe they decide makeup's not for them. That's not how they want to present themselves. They hate dresses. I know plenty of cis women who don't like wearing dresses. And personally, if I could get away with wearing a dress all the time, I would 100% wear a dress all the time. And that's me, right? So you imagine that it's almost an infinite amount of variability between the highly feminine and the highly masculine. And most people aren't at the very ends of the spectrum. Most people fit in the middle. And then non-binary people, the way I think about it is they're kind of here as they're kind of like home base. Some people do this thing. Some people live right here. Some people choose to not be one or the other. And and that could segue into pronouns, but we definitely have more definitions to go through if you.
Yeah. So just, certainly this is not a complete vocabulary on this topic, but just a couple other things I wanted for my own learning. Transitioning and transitions.
Gotcha.
Can you break that down?
Absolutely. So it is unlikely. For me, I don't feel like I'm ever going to, I have completed transition. And this is, I always am trying to improve myself in my life. I read things apart from, gender and sex and stuff. I read stuff because I want to learn a little bit more about the world around me. Sometimes I have a thing that I do. Let's say on a certain day, I'm not super patient with my kids, right? Mm-hmm. And then I think about it, I'm like, man, I kind of messed up. I realized what happened. I'm going to work to continue to be a good parent, right? And so transitioned with an ED at the end is not a word that I guess applies to me because I'll never feel like I am exactly where I want to be. And it's not that I'm an unhappy person that is not satisfied with where I am. I'm very happy at every stage that I've been. but I always feel like I will be transitioning essentially. Now, transitioning is the process from going from one gender to the next or to the other. That is the definition as far as my understanding.
Yeah, it's interesting. I chose the name Revitalizing Doctor specifically because I don't ever feel like I will be revitalized. I feel like we're all on our journeys. And even though it's a longer, maybe in some ways more awkward title, Revitalizing, it was the verb that I felt encompassed what we're trying to do here.
Yeah, because words matter.
Right. Yes, words matter.
Mm-hmm.
Yeah. All right. So let's move into talking a little bit about another area that I think people get confused and wrapped up in.
Mm-hmm.
And, you know, there's a difference between sexual orientation and thinking about how that interfaces with gender.
Mm-hmm.
So while this is a huge topic, can you break it down for people a little bit about how to maybe pull those two concepts apart and they're not overlap
Of course.
all the time?
Yes. And that's, I think this is 2023 and there's a lot of kind of politically charged words that are out there a lot. And it's funny because I remember there was this poll that I read that said that most people that have problems with trans people have never spoken with a trans person. It was like literally like a poll that was done and they don't know us and they have no idea and they hear things and they don't really understand what it is. So sexuality and gender, really they're two completely different things that are not mutually exclusive at all, right? Now just think about just a cis couple, right? You have a man and a woman, cis man, cis woman together. Not all of those couples are the exact same as far as their sexuality, right? And it's the same thing with trans people. I mean, I am trans and I am sexually attracted to women. And that is something that was there before. And it's something that did not change when I was able to finally, I guess, outwardly express the way that I was inside. It's not like I became trans and then I became sexually attracted to men. It's not how it works. Additionally, another like big thing that to me, and I kind of forget sometimes that this is not something that people automatically know. I mean, we as we're saying this is going to be like, well, of course that's correct. But sometimes without like knowing it, we don't really like think about it. Me being trans has nothing to do with sex. It truly does.
Thank you. Tell me more about that.
So the thing that I'm seeing kind of a lot is the fact that this is about kind of sexualization and about intercourse, to use like a kind of PG dry word. And it really is, I'm not doing this in order to have, I guess, like a sexual experience, because my sexual experience has not changed. I'm doing this because I want to be happy. Actually, early on, one of the things that I realized was that it would, I call it my non-binary era, when I was trying to figure out like what would I be able to do? I felt this way, but I didn't know if it was possible. I didn't have the tools. I didn't have the words. I hadn't had the surgeries and the medicines and stuff like that have helped me dramatically. So early on, one of the things that I realized that actually like helped me out a bunch was this concept. And I remember telling my brother about this, and it actually was one of the things that helped him understand me the most. Wearing men's clothing out gave me more anxiety than wearing women's clothing out and being ridiculed. And notice that has nothing to do with my sexuality. I didn't mention that, and it obviously has nothing to do. And it was my truth and my reality. And that is what being transgender is. Just like being cisgender, that is not inherently about sex. It's about where you want your role to be in society, right? It's the same thing for us.
Yeah. And, I think both of us are big fan of Glennon Doyle's podcast. We Can Do Hard Things. And I love Abby Wambach. And she talked about it on the podcast that it's weird how people, when they find out that someone's gay, they then have like a lot of questions about their sex life. And so I think, getting into some of the questions that are okay and not okay, I mean, I think hopefully we can inspire people that being trans is not a sexual orientation. That's
Correct.
different.
Mhm.
And that you shouldn't be asking any questions that are about what people do in their bedroom. Like nobody asked me, thank God. I mean, we're laughing. It's ridiculous. Would anybody at work ever come up and like ask a very specific question?
Yeah.
They wouldn't. But what Abby was talking about on that podcast is there's this hypersexualization of gay people. And I think some of that also extends to an hypersexualization of trans people. And then I think what's weird is you're not putting that out there. Like you're not trying to like invite people to do that. But for some reason, I think it's because of, you know, some of the tendencies we have in America around sex that we go there very fast.
Yeah, it's interesting, but I've gotten asked this question in almost every situation. I've had it asked by like people at work, like in the hospital, like my coworkers have asked me this, and friends, relatives who I've never met before, random people I've never met, and then good friends that have good intentions, but they don't like think about it. There's a few questions that are not a great idea to like ask because they're ridiculous questions anyways. Are you having the surgery? Surgery implying a genital surgery. And I just think about it, and I personally, like, I'm okay sharing with what I'm comfortable sharing, but in what situation is that normal? Like, I wouldn't walk up to somebody that was essentially an acquaintance and say like, hey, how is your clitoris doing?
Right. Oh, you just had a kid. Did everything turn out okay down there? Are you going to have to have any reconstruction?
Has it gone back size? Did you
Right.
have
Like,
to have like stitches? Like, that's not a normal question.
Right.
And and so I get asked that a lot. And honestly, most of the time, I try to be like kind about it. And because I know that, well, I choose to believe that most of the time they're not understanding why that's bad. And so I usually try to use it as an educational tool to try and help, because I know that, well, when I get asked that question, I'm like, that's weird. That's usually like what I think, but I'm not like offended necessarily. I mean, I don't like the question, but it's not like it crushes me. It's not like it's a trigger for me necessarily. But for some trans people, that is a very charged and triggering question to ask. I almost view it as like, I have to address it so that maybe other trans people that are less comfortable talking about it don't have to talk about it because the information's there.
I'm so glad we're getting this information out there because I think, well, you tell me, I mean, the way people end up transitioning is highly individualized. Some people that will involve surgeries, a lot of people it won't. Some people may take hormones, some people don't.
Right.
The way people dress, we just talked about, like that varies even if you're not trans.
Right.
So there's, I guess what we're inviting people to do, we're going to keep using the phrase over and over again during the episode, is to be curious. And if you've met one trans person, you've met one trans person.
Right. You just met one. It's not all of us.
Yeah.
Yeah, that's very true.
Yeah.
No, I agree with all of that. And again, everybody's journey's their own.
Yeah. Yeah. So just be more open to getting to know the individual. Across anything we're talking about with equity, I think that's what we're trying to get to. Nobody wants to be lumped in with a group. We're all, and I think in America especially, we value individualism.
Yeah.
So the same concepts apply to trans people. I think maybe because there's fewer people, maybe part of what we're bumping up into is, I've shared with you, and this kind of fast forwards into what we want to talk about, using correct pronouns. I still trip up sometimes. And it's, I've really thought about it. I'm like, do I know anybody else? Have I ever been this close of friends with anybody that's trans? And I don't think I have been. So I'm having to learn a lot.
Yeah. Yeah. The pronouns thing, I definitely want to spend some time on that. Now, I do want to kind of take just like a medium, like a very tiny step back and talk about, I guess, the difference between a social transition and a medical transition.
Oh, please. Yes.
So a social transition is basically wearing the clothing, the accoutrements of the opposite gender, right? So that's a social transition. So instead of, wearing men's clothing, for me, it would be wearing women's clothing. That would be a social transition. And then a medical transition is a very broad field. It can be as little as, because I started off probably 2 years ago with testosterone blockers. And then a year ago on this coming weekend, actually, I've been on estrogen. And I've so far had one surgery. I've had a nose job and a bit of a tracheal shave. And so that would be a medical transition. So I am socially and medically transitioning.
Thank you. I think that's really, really helpful. And we're not going to get into patient care at all today, but I also think that's really helpful when we're communicating with patients and understanding their surgical history and their medication that they're on. There's, so many people out there providing great content on how we can be more medically aware as well.
Absolutely.
That was such a powerful conversation, and I can't wait for you to hear part 2 next week. We get into some really interesting topics around intersectionality, experiences of seeing the world from a man's perspective and then from a woman's perspective. It's a really interesting conversation. Dr. Avila is also founder of Core Ultrasound. You can find her at Core Ultrasound on Twitter and Instagram. You can also find her at Instagram, JAILYN_AVI. Thanks for listening to The Revitalizing Doctor, a project of Revitalize Women Physician Circle. Our mission is to connect women physicians and allies through innovative, value-based coaching methods that align trust, support, accountability, and skill development to ignite the courage and clarity necessary to take bold actions, create change, and thrive. If you're interested in working with us, check out our website at peoplealwayshcc.com/revitalize or email us at revitalizemmm.info@gmail.com. This podcast represents the views of our host and guest. It does not reflect the views of any institution we work for or with.
Hi, it's Dr. Risa E. Lewis, dropping in to tell you about a book that Dr. Adara Landry and I wrote. It's called Microskills, Small Actions, Big Impact. It's a business self-help book coming in 2024 by HarperCollins. Pre-order now. Microskills, Small Actions, Big Impact, wherever you buy your books.